Speak. Minister, thank you so much for joining us. I was just doing a little bit of padding as you were getting connected there. But what I was saying is we really appreciate you taking time out of your busy schedule today to join us. And I know that you will be logging off afterwards. You don't have time for questions, but we really appreciate you making this a priority for you today. I'll hand over to you now. Thank you.
Good morning, Geraldine. Sorry, just come out of an executive meeting, so I don't know if they'll wait on me to come back in anyway. But no, look, it's a pleasure to be here this morning with you. And can I say good morning to you all, and thank you to Nexus and Victim Support for inviting me actually to open today's conference. I am delighted to be involved, and I'm encouraged by the number of you who have taken time out of what is very busy schedules to be here this morning. I think this is an excellent opportunity in what are, I think we all know, very challenging times for us to come together and share learning. Actually, as we mark this year's Sexual Violence and Abuse Awareness Week. Today's session focuses on the health and well-being of victims and survivors. It is also important that we acknowledge and raise awareness of the help and support that continues to be available throughout the COVID-19 pandemic. We all know that anyone can be a victim of sexual crime, regardless of age, gender, sexual identity, or orientation. And actually, for many, the impact of the trauma experience goes far beyond physical injury. The psychological and emotional effects can be shattering, and they are very real and can manifest themselves in many ways. Probably most significantly, perhaps, sexual violence and abuse can have a devastating impact on a person's mental health. We know from the experiences of victims and survivors that this can result in long-term effects such as anxiety, depression, and post-traumatic stress disorder. So I want to, as Minister, commend the individuals that have come forward to share their stories. It must be extremely difficult, but your voices help us to better understand the impact of this trauma, to dispel the many myths around sexual violence and abuse, and importantly, to actually strengthen our service response. Since becoming Minister for Health, I have said repeatedly that mental health is one of my top priorities. And as you're aware, I've appointed Northern Ireland's first ever mental health champion, and I am delighted that you will be hearing from Professor Siobhan O'Neill later in today's programme. I've also launched a consultation on a new draft mental health strategy, which will run up until the 26th of March. And I would encourage everyone to take time to respond and share your views, be that personal views or that of the organisation that you belong to and represent. There is, of course, a great deal of good work already being done right across the statutory, voluntary and community sectors. I met with the Nexus team last year and heard firsthand of the vital work that continues to be delivered through their specialised professional counselling service. It is clear that referrals to this service are on the increase. In a way, this is encouraging, as it means that more victims are coming forward to seek help. And I am pleased that I've been able to provide Nexus with some additional funding, which I hope will go some way to reduce the waiting lists so that victims can get the help and support they need. I'm acutely aware of the impact that COVID-19 pandemic continues to have on psychological well-being of victims and survivors of sexual abuse and indeed domestic abuse. I want people to know that they're not alone and that help continues to be available 24/7. My department continues to work closely with Nexus, funding the Domestic and Sexual Abuse Helpline, and that's done in partnership with the Department of Justice and the Department of Communities. And this is a confidential free phone service available to both women and men, because help is only a phone call away. And anyone suffering from domestic abuse can now also seek help through its pharmacies, which are participating in the Ask for Annie code word scheme. My department, along with the Department of Justice, has been working closely with the Home Office to help develop this new initiative, which I very much welcome, and I know some of you here today have also contributed to that work. A trip to the pharmacy may be the only chance victims and survivors have to access emergency support as we continue to live with COVID-19 restrictions. By asking for Annie and Boots stores, a trained pharmacy worker can offer a private space if someone needs to speak to the police or would like to contact the 24-hour domestic and sexual abuse helpline. The Rowan Sexual Assault Referral Centre is another 24/7 service with a professional and highly trained team continuing to help victims and survivors recover both physically and emotionally. And indeed, there are many organisations here today that continue to deliver vital support in the face of this pandemic. And I'm incredibly grateful for the commitment and dedication of the many charities, community and voluntary sector groups, and individuals who have adapted to new ways of working. It is impressive that despite these challenges, that you continue to identify and maximise new opportunities to work together. We've all seen this over the last 12 months as partners have come together to deliver the IRIS pilot, to train and support GPs in identifying and referring patients affected by sexual abuse and domestic abuse to specialist advocacy support. We know that someone affected by sexual abuse will often go to their GP with a variety of symptoms that are not obviously connected, such as anxiety and or depression. And as I mentioned earlier, however, many will not disclose abuse without directly being asked. IRIS aims to better equip general practice staff to ask about and respond to abuse in a sensitive, knowledgeable, and confident way. The initial reaction to the person the victim tells and the follow-up within and beyond the health service can have a profound effect on their ability to re-establish their life, health and well-being. And I'm pleased that despite the challenges of the pandemic, my department has been able to continue with this pilot across 2 GP federations. And thanks to the hard work of Women's Aid, Victim Support, Nexus and Men's Advisory Project, I believe that collaboration and co-production is where we can and where we do add most value. So in closing, I would once again like to thank Victim Support and Nexus for organising today's conference, which looks to be a very interesting event with a great cast of speakers over the next 2 days. And as I said, unfortunately, when I came in at the start, unfortunately, due to other commitments, I'm unable to stay for the rest of today's event. But my officials will listen with interest, and my department will, of course, help to raise awareness throughout this Sexual Violence and Abuse Awareness Week. So I hope you enjoy the conference, and I wish you well. And I thank you very much for the opportunity to speak, albeit briefly, and be with you this morning.